A question I frequently get is, how do I dermaplane the nose? It makes me uncomfortable. If you've ever felt this way, you're not alone. The nose is an essential part of any facial treatment, and for many clients, it's a problem area. That's why addressing it correctly is so important. However, since no two noses are alike, working in this area takes patience and practice. In our advanced dermaplaning techniques class, we go into this topic in much greater detail, but today I'm going to give you some key pointers to help you feel more comfortable when dermaplaning the nose. Let's get started. The first thing you should do is always evaluate the nose. Look for rough patches, bumps, or anything that might inhibit your blade from gliding smoothly. This also helps reduce the risk of injury. Take your time with this step. Your results will be better if you know what you're working with. I recommend working in 3 sections: the median or center and the 2 lateral sides of the nose. Work on small sections at a time, starting at the glabella, which is between the brows, and move downward. Since there's no subcutaneous tissue here to act as a buffer, very little pressure is needed. To stabilize your hand and maintain control, brace your thumb between the brows, placing your index finger about halfway down the nose on the bone, not the cartilage. This keeps the skin taut and allows for smooth, controlled movements. Always use short strokes to prevent dragging on the skin. Short, precise movements will give you better control and improve safety. As you move past the root of the nose and onto the dorsum, I recommend using a technique called tenting. This involves pulling the skin up and over the bony area, allowing you to dermaplane without pressing on the underlying anatomy. This technique is especially useful in this area where precision is key. When you reach the tip of the nose, simply roll the skin between your fingers to finish dermaplaning this area. This will help you achieve a thorough exfoliation without unnecessary pressure. For the lateral sides of the nose, reposition yourself so you're working directly on the side that you're treating. Use your thumb and pointer finger to hold the skin taut, spreading open the sides of the nose, then dermaplane towards yourself using short strokes. As you move onto the ala and the alar groove, use the curvatures of your blade along with the tilt of your handle to access these tricky areas. Don't be afraid to change directions or deviate slightly from the standard 45-degree angle. In these areas, a lesser angle provides a gentler exfoliation while still achieving great results. While you work, always be mindful of where your blade and handle are in relation to the eyes, nose, and ears. Safety is top priority, and if you ever feel unsure about your bracing or angle, flip the blade over and use the dull side first to practice your positioning before making any passes. Remember to relax, breathe, and take your time. When we get uncomfortable, we sometimes forget to breathe, which only makes things more difficult. With patience and practice, dermaplaning the nose will feel much more natural. If you found these tips helpful, imagine what you'd learn in our advanced dermaplaning techniques class. We go even deeper into precision techniques, advanced maneuvers, and troubleshooting common issues. Click the link in the description to learn more and take your dermaplaning skills to the next level. Thanks for watching. Don't forget to like, subscribe, and hit that notification bell so you never miss a new video.